Hello, today I'll be demonstrating the proper technique on how to perform tracheostomy suctioning. First, we're going to check and verify our order with the MAR. After we checked and verified our order with the MAR, we do our right checks: the right patient, the right route, the right time, and the right procedure. After we've done our right checks, next we go and gather our supplies. After we gather our supplies, we make sure the supplies aren't expired. Then we go in and we identify our patient. We get them to state their name, their date of birth, and we check their armband. After we've identified our patient, we explain the procedure to them. After we explain the procedure, we answer any questions that they may have. After we've answered our questions, we go ahead and provide privacy for our patient. After we provide privacy, next we go ahead and wash our hands. We assist our patient into the Fowler's position. Once we've assisted them into the Fowler's position, we go ahead and turn on our suctioning. After we turn on our suctioning, washed our hands, and we've explained everything to our patient. The patient has no concerns. Patient is in the proper position. Now we can go ahead and start with our suctioning. So after we've turned on our suctioning device, we go ahead and wash our hands again, and now we're ready to perform our suctioning. So we've already turned on our suctioning device. Alright, we have our supply kit with our gloves and our cannula. So we go ahead and open it up. Okay. We have our oxygen saturation monitor to check our oxygen level after we completed our suctioning, and we also have our stethoscope to listen to the lung sound after we completed suctioning. So this is also our kit that I've gotten to use to hold our saline solution. So I've gotten it. I've applied my saline solution to the container. So now I can go ahead and put on my gloves and retrieve my Okay, now we can remove our suction apparatus. Make sure that the tip is controlled with your dominant hand, and your non-dominant hand operates the suctioning with your thumb. So next, we're going to hyperoxygenate our patient before we start our suctioning. So we're going to go ahead and moisten the tip of our suctioning to prepare it for suctioning our patient. And we have our trachea, which is here. So now we've already hyperoxygenated our patient, gotten them to take 3 to 6 breaths, or using the artificial oxygen. So we've already hyperoxygenated them. So we're going to go ahead and insert the cannula tip. With continuous suctioning, we're just going to go ahead and insert it until you get a gag response or you meet resistance. Once you've gotten resistance, you go ahead and apply suctioning with your non-dominant hand, and you remove it out of the trachea. Then you take and clean it, and go ahead and replace your oxygen. Or to provide intermittent suctioning, you go ahead and apply the saline solution and you go ahead and after you've already hyperoxygenated them again, you go ahead and wait until you get the cannula into the proper area where you either meet resistance or the patient coughs. Once they're in that area, then you start your suctioning. You apply suctioning for 10 seconds. You move it in a circular motion until you have made it completely out of the area. You encourage the patient to cough and deep breathe in between the suctioning. Cleanse the catheter again. Once again, do not start suctioning until after you have inserted the catheter tip suctioning device into the cannula. Once you've reached the area where the patient is either coughing or gag reflex has been stimulated, then you apply your suctioning and you remove it in a circular motion until the suctioning is out. So you do that until the suctioning is clear. You replace the oxygen. Once you replace the oxygen, you encourage the patient to deep breathe. Replace their oxygen source. You take and you check the oxygen level. Monitor any secretions. You listen to their lung sounds to see how their lungs are sounds, how they tolerate it. Ask the patient how they tolerate it. The patient tolerated the suctioning well. You've already replaced the oxygen. No further secretions. The lung sounds are clear. You've already listened. The lung sounds are clear. So you make sure that the patient is comfortable, no distress. Call light and reach. You make sure answer any more questions. If no other questions, you remove your supplies. You wash your hands and you document. Thank you.